so much to Martin and to Dr. Tedros. Now, being at this summit, of course, you are amongst some of the world's foremost leaders at the intersection of climate change and its impact on human health. And most of you are already quite knowledgeable on the subject, and you've probably learned a lot on what you already know by reading what most of us consider to be the premier source of evidence-based knowledge and guidance on this topic. The Lancet Countdown is a collaboration of 120 leading experts from academic institutions and UN agencies working to ensure that health is at the center of how governments understand and respond to climate change. And so our first speaker for the day is the Executive Director of the Lancet Countdown, Dr. Marina Romanello. Dr. Marina is a climate change and health researcher at University College London. She holds a PhD in biomedical sciences, and her research ranges from toxicology to environmental health and climate change. And she joins us live from London. Welcome, Marina.
Hi, Sally. Thank you so much. Happy to be here with you.
Yes, it's wonderful to have you with us. Thank you so much. This is very early in London, by the way, everybody. So we're so glad that you made the time to be with us for this incredibly important report that will set the stage for the summit today. So, Marina, the 2022 report of the Lancet Countdown on Health and Climate Change, it has all kinds of disturbing statistics about the worsening effects of climate change on human health, and directly whether it is through extreme weather events or indirectly through threats to food production and all kinds of other increases in diseases that I know you're going to be telling us more about. But the report also indicated that only half of countries in a recent survey reported having assessed, in fact, their climate change adaptation needs. So why is it, do you think, that we are no further along in understanding what kinds of defenses are most urgently needed?
Well, thank you so much, Sally, for that question. And first and foremost, thank you so much to Malaria No More and Reaching the Last Mile for setting up these wonderful events. I'm so sorry I cannot be with you there in person. I would have loved to. And particularly thank you to everyone that is there in the audience, their excellencies and all the participants. I'm really delighted to be here with you, at least virtually. So you ask a very pertinent question, Sally, that is, why haven't we gained awareness and acted on climate change much, much sooner? And that is perhaps a very complex question. We've known about climate change for decades. For at least half a century, we've known just how grave climate change is. And the first IPCC report in 1990 already talked about the potential health impacts of climate change. It laid out much of what we know already today. And yet since then, very little has happened in terms of climate change and health. Most of the action and of the addressing of the intersection between climate change and health has happened over the last 10, 20 years. And that is still very little. And we have somehow dehumanized the climate change argument, the story of climate change. We have made it about polar bears in the year 2100. And we have forgotten that what climate change is doing is undermining and destroying the natural environment and the natural ecosystems that our health and our well-being acutely depends on. So climate change is about us, our health, and our future.
It's astonishing to think that we still think of it as something completely separate to us. That what is happening to the environment and to nature is not intrinsically affecting who we are as human beings and how we can survive and thrive. And so today, Marina, we have an incredible audience with us who are waiting to hear your presentation of the latest Lancet Countdown report, and they're eager to know what's in the works this year and what we can all do to help. So over to you, Dr. Romanello.
Thank you so much, Sally. As Sally said, I'm going to present you some of the findings of our latest report, and I'm going to show you loads of data, loads of graphs. But what I'm hoping that at the end of my talk, you will have gained a bit of an understanding and an overview of what is the science telling us about the intersection between climate change and health, what we know about what's happening, and what we can do about it. So if we can go to the next slide, please. Excellent. So starting a bit from the beginning of this story, in 2009, the Lancet published its first ever commission. You know, the Lancet has this series of commissions, one of the most influential journals in the world. And in this first ever commission, they looked at the intersection between climate change and health, trying to gather the scientific evidence with an interdisciplinary team of experts. And the conclusion that this commission reached was that climate change is the biggest global health threat of the 21st century. A pretty daunting conclusion that at the time was met with a bit of skepticism. But that mobilized the health community, and around the same time, a bit before, the WHO had reached that same conclusion. Since then, a lot of work has been going on in terms of better understanding these links, and just 6 years later, the science had moved fast enough, next slide please, that the Lancet published its second commission. And this is very important. That second commission had a similar conclusion. Climate change is undermining the health of people all around the world. But most importantly, tackling climate change and climate action could be the biggest global health opportunity of the 21st century. Not only because we will be avoiding all the health harms that we're generating through climate change and through our continuous emissions, but also because most of the actions that we need to undertake in order to tackle climate change align very well with the most sensible and desirable public health interventions, including cleaning our air, increasing our physical activity, eating healthier, more plant-based diets, having better, more livable cities, and improving our mental and physical health and well-being. So that commission concluded, and it was published, if you can see the dates there, in 2015, the same year that the Paris Agreement was signed. So it concluded that as we move along in terms of delivering the ambitions of the Paris Agreement, we could be carving the way to a much better, thriving, healthier future. And what we needed to do then is to assess the extent to which countries are delivering against their commitments in the Paris Agreement, and how those commitments, how that delivery is enabling a healthy future and delivering the health benefits that come with it. Next slide, please. So it is after that commission and with that ambition of monitoring how we're moving towards a healthier future that the Lancet Countdown was set up. The Lancet Countdown, as Sally said, is an organization, a big collaboration of leading UN agencies and academic institutions from around the world. Today, collectively, we have more than 100 researchers working in developing this monitoring exercise, both globally and regionally. And the whole global collaboration of the Lancet Countdown brings about 300 people together today. Next slide, please. So each year we publish these reports in the medical journal, The Lancet. They get published ahead of the COP climate negotiations with the ambition that the data that lies within them will help inform and guide a more health-centered, more ambitious climate negotiation. The report that you see there in large is our latest report. It has over 44 indicators that we've been annually updating and improving, and its title is Health at the Mercy of Fossil Fuels. So you can read a lot more on it if you go to lancetcountdown.org, and you can find more interactive data visualizations there. But I'm going to tell you some of the key findings of that report. Next slide, please. And the main finding that comes with it is that we're seeing a persistent increase in greenhouse gas emissions. We haven't curbed greenhouse gas emissions. And that increase is amplifying the health impacts of climate change, and importantly, reversing progress that we have done over the past decades in terms of global health improvements. Next slide, please. The perhaps more obvious health impacts of climate change, when we think about climate change, the first thing that comes to mind is increasing global temperatures. And we know that extreme temperatures are very dangerous, particularly to vulnerable communities, people living with underlying health conditions, the poor in urban areas that cannot take care of themselves, pregnant women and their babies. There's a lot of data coming up about the adverse effects of extreme heat exposure in pregnant women and in their birth outcomes. And there's two very vulnerable age groups that are children under 1 year of age and adults over 65 years of age, for whom exposure to heat waves represents an acute health hazard. So what I'm showing you here is an indicator that monitors the exposure to heat waves of these two very vulnerable age groups, children under 1 and people over 65 years of age. And what we see is that from 1986 to 2005 until present day, there have been 3.7 billion more present days of heat waves per year. This is 3.7 billion single exposure events, single events in which people were put at acute life risk. And we're seeing that that is mainly driven by the increase in temperatures, as well as obviously aided by a changing demographic and an aging population that is making us more and more vulnerable. And as a result of that, we're seeing that heat-related mortality since the early 2000s has increased by 68% in people over 65 years of age. And climate change will not only be affecting through morbidity, through mortality, it also undermines our labor capacity, it disrupts supply chains, it disrupts our crop productivity, as I will talk to you in a moment. Next slide, please. And aside from the rising temperatures, what we're also seeing as a result of climate change is a change in precipitation patterns. We've seen over the past year devastating droughts all around the world. Europe has had an unprecedented drought last year. We had cuts in water use here in the UK, an area that is traditionally very, very wet. We had to cut our water use. In South America, where I'm from, Argentina is suffering an extended drought of over 3 years that has absolutely devastated crops. And we also have an acute health emergency in the Horn of Africa, where drought, alongside conflict and other events, has driven millions to starvation. As you can see there in the slide, we've seen that since the 1950s, almost 30% more of the global land area was affected by extreme drought each year. And you can see in the graph that I'm showing you there on the left, just how fast the incidence of drought is increasing in terms of the land area affected. And what the map is showing you in red is those areas that are more heavily affected by droughts. And as you can see, Africa, North Africa, South America, Southeast Asia, areas that are particularly vulnerable, that are already struggling with water insecurity, food insecurity, and poor sanitation, are being particularly affected by the increased incidence of drought. So this is now undermining the collective progress we have made in terms of food, water security, and sanitation globally. Next slide, please. And for the first time in the report that we published in November 2022, we have assessed the influence of the increasing heat wave days on food insecurity. And we have seen that from 1981 to 2010, the increasing heat wave days was associated with 98 million more people self-reporting not being able to access the food that they needed, because we know that the increased temperatures are undermining crop productivity, are undermining labor capacity, are having impacts on the socioeconomic determinants of health, and therefore all of that compounds on food insecurity. And that has happened at the time in which global food supply chains were disrupted by the war in Ukraine, where the rising fossil fuel prices has driven an inflationary crisis that had made food more and more inaccessible to millions. So we have these compounding impacts whereby food insecurity is being undermined through many different fronts, and climate change is making the situation so much worse. Next slide, please. And just to finish on a few of the impacts that I wanted to show you, one that is, I think, of particular interest to this audience is that the changing weather conditions, the changing climate conditions, are making the environment more and more suitable for the transmission of infectious diseases that are of particular health concern. We're assessing a few infectious diseases in our report. As you can see there, we have dengue, malaria, Vibrio cholerae, and other vibriosis. And in all of them, we're seeing that the range in which we can find environmental suitability for their transmission is increasing, exposing more people to these threats, particularly people in latitudes and heights that were considered previously relatively safe from these diseases. Looking at dengue, the environmental suitability for dengue transmission is increasing very rapidly, particularly in South America and in Southeast Asia, to endemic areas where it represents a significant burden of disease. And looking at malaria, in places like South America, Africa, we're seeing the highland areas that were particularly considered safe from malaria before becoming more and more suitable for its transmission. So more people are being exposed to this hazard. So we're seeing a combination of climate change impacts across many of the pillars that determine our health. increasing the incidence of non-communicable and communicable diseases, undermining sanitation, food security, water security. And this means that there's an increasing pressure on our health systems. Health systems are having to cope with an increased burden of disease as a result of climate change. So it is so crucial that we increase the resilience of our health systems and we adapt to climate change to be able to cope with these increased pressures. Next slide, please. So when we look at what's happening in terms of getting prepared for these increased pressures, here I'm showing you just one example, but this is kind of the same pattern across the scope. I'm showing you here the extent to which countries have implemented the international health regulations that pertain detection, preparedness, and response to health emergencies. These are regulations and capacities that are meant to help countries cope with outbreaks of infectious diseases in particular. And we've seen with COVID-19 just how important having those capacities in place is, even if they're not bulletproof. And yet, of the 177 countries that reported this implementation, only 63% had high to very high levels of implementation for health emergency management. And if you can look at the right graph that I'm showing you there, what we've done is stratify countries according to their Human Development Index. That is an index that takes into account different aspects of human development, like GDP, education, and health outcomes. And as you can see, countries with very high Human Development Index have 88% of them have implemented high to very high levels their health emergency management capacities. But when we look at countries with low and medium levels of Human Development Index, they're lagging behind, with only about 33 to 36% of them having implemented these capacities. Which means that the most vulnerable countries, those most heavily impacted, are also lagging behind in strengthening their health systems to be able to cope with these added pressures. And as a result, the gap in health inequities will be amplifying as a result of climate change. So it's crucially important that we increase the resilience of our health systems. But I have to kind of disagree with Martin just now. He just said that climate adaptation is the biggest investment in global health. And it's true, it's a very important investment. But I would say it's not the biggest investment. Because unless we tackle climate change, unless we keep global mean temperature rise to under 1.5 degrees, the pressures on our health systems will rise so much that it will be impossible to adapt to them. It will be a very inefficient investment to just look at adaptation. We have to do what the WHO has named primary prevention, that is mitigating climate change, keeping global mean temperature rise to 1.5 degrees, and ensuring that we reduce pressures on our health systems. Pressures will increase regardless. So we have to first mitigate and adapt to 1.5 degrees. Any other than that will be impossible to adapt to. Next slide, please. So I've talked to you about the importance of keeping to 1.5 degrees. The bad news is we're currently heading to 2.7 degrees. And there's an enormous cost of the delayed transition to a net zero future. Next slide, please. Looking at the energy system is the biggest single contributor to the climate crisis, mostly driven by our continuous burning of fossil fuels. When we look at the global carbon intensity of the energy system, which is the amount of carbon dioxide emitted per unit of energy that we're generating, we have practically not decarbonized our energy system. We have reduced the carbon intensity of the energy system by less than 1% since the year that we signed the UNFCCC, the UNF Framework Convention of Climate Change, where countries collectively agreed that we would avoid dangerous anthropogenic interference with the climate system. So we have not fulfilled that promise so far. And what is even more concerning is that energy-related emissions have reached a record high last year and the year before and the year before. So emissions are still going up as a result of our increased overuse of energy and our lack of implementation of energy efficiency solutions. Next slide, please. And while we have done a lot of progress in terms of new renewable energy, solar and wind in particular, and our adoption of new renewables, particularly for electricity generation, as you can see in the graph, is going up really rapidly. New renewables still represent only 8.2% of all the electricity that we're generating globally. And as you can see in the graph there, I hope that you can read the writing, there's enormous inequalities in terms of that transition. Very high Human Development Index countries are by far leading the way. But low human development index countries, those countries that are the most vulnerable, are lagging behind enormously. Only 1.4% of all their electricity comes from new renewables against 9.5% in high human development index countries. So in the adoption of clean renewable technologies, we're leaving the most vulnerable countries behind. Next slide, please. And this matters for health. This matters enormously. First, because it's driving the climate crisis. And second, because it's having immediate impacts on our health. We know that the burning of dirty fuels, fossil fuels, and biomass that comes from the slow adoption of clean energies is leading to at least 3.3 million deaths from PM2.5 particulate matter air pollution every year. And 1.2 million of those deaths are directly related to the burning of fossil fuels. And again, as you can see in the graph there, very high human development index countries have generally very tight air pollution control measures, so they're relatively more protected, whereas countries with high and medium human development index that are rapidly industrializing are doing so without so much control of their air and air quality. And therefore, the burden of disease is so much higher in the less developed countries. Next slide, please. And perhaps what concerns us the most in terms of energy is the lack of access to clean energies in people's homes. Only about 70% of the world's population has access to clean fuels and technologies for cooking. 30% still lack it. And if we look at countries with low human development index, only 13% of the population has access to clean fuels and technologies for cooking in their home, which means that 87% of them are still using dirty fuels inside their homes, breathing toxic air where they live. Again, if you look at the graph on the right, big differences in different human development index country groups, with the very high human development index, by and large, having access to clean energies for cooking, and low human development index countries lagging behind. And we've estimated in 62 countries, we've done an analysis of 62 countries, and estimate that the air that people are breathing inside their homes exceeds by over 30 times the level of PM2.5 pollution that is considered acceptable by the WHO, 30 times higher PM2.5 levels than considered safe. And we're seeing that with the cost of living crisis over the past year or so, the rising energy prices, people have turned more and more to the use of dirty, cheaper fuels and biomass burning. In places even like the UK, London, we're seeing air quality getting worse and indoor air quality getting more toxic because of our lack of access to clean energies. Next slide, please. And we have some indication of why this is. Aside from the fact that we have been very slow in transitioning our economies and in transitioning our energy systems, of 86 countries that represent 90% of all global greenhouse gas emissions, 80% still had net negative carbon prices in 2019. This means that 80% are still providing net subsidies to fossil fuel burnings, providing financial incentives for the continuing burning of the fossil fuels that are damaging our health and undermining our future. The net total allocated by those countries was $400 billion in 2019. This figure has gone up with the rising energy costs. And this is in stark contrast with the delay of highly industrialized countries in delivering the $100 billion that we've committed to in 2019 Copenhagen Accord to support the low and middle income countries in a just transition to a healthier future and to a net zero future. So we're not supporting a healthy future, but we're still subsidizing fossil fuels. So the money is there, it's just in the wrong places. And as you can see in the graph on the right, what I'm showing you there is the total spend for each country in fossil fuel subsidies, presented as a percentage of the total funds allocated to their health budgets. And you can see that 5 countries allocate more funds to fossil fuel subsidies than to a total health system. And many of them allocate more than 10% to fossil fuel burning than to their health systems. So our priorities are not put quite in the right place. Next slide, please. So it's very good to talk about renewed ambitions and renewed commitments and going to a new COP with a lot of ambition and hope. But what I'm showing you here, the graph and the line that you see in that graph represents the concentration of greenhouse gases in the atmosphere. The colored stripes, you might have seen them, they're the climate stripes, represent the temperature change in time. And what the arrows show you and the text show you is what we've achieved, which is each subsequent climate negotiation. And as you can see, we haven't achieved much. Emissions are still going up, unabated. We have not curbed emissions. And although we each year make renewed ambitions and renewed claims, and we meet in fancy venues to talk about this, we have not really taken action. And unless we curb emissions, there's no hope for us to be able to cope with increased pressures of climate change. And that is why it's so crucially important that health professionals are at the forefront of the climate negotiations and the climate ambitions, both for mitigation and for adaptation. Next slide, please. So just to close, we're at quite a critical juncture. The latest UNEP report of the emissions cap report has said that we have a rapidly closing window of opportunity to keep global mean temperatures at a livable threshold. It's not anymore about healthy, happy lives, it's about livable futures. Now, as we're trying to devise responses to the global energy crisis, the turmoil in energy markets that are generated, we need to reduce our dependence on fossil fuels. We need to increase our adoption of clean renewable energies and reduce our energy consumption through energy efficiency measures. And in that, we have an enormous opportunity to deliver healthier air, healthier diets, more friendly cities, cities centered around people that can allow us not to only have a future in which we can survive, but we can also thrive. So with that, next slide, I'll finish my presentation and I'll be very happy to take any questions from you. If you want to know more about our report or explore any of this data, you can visit lancetcountdown.org, where we have an interactive data platform and you can find more about our work. Thank you very much.
Thank you so much for that, Marina. We are actually going to be opening up the floor to questions, so please have your questions for Marina ready. Before we do that, I have a couple of questions of my own. So, Marina, health professionals are becoming more and more concerned with the connection between climate change and the health and well-being of communities on every level. What is the role then of a global health workforce in addressing the health impacts of climate change and reducing the reliance on fossil fuels?
Thank you, Sally. Well, health professionals have the mandate of protecting the health and well-being of our people. We're here to protect their health and the health of world populations. And as you have seen, climate change is the biggest threat to our health of the century. It's an unprecedented challenge that we're facing, and it's an existential crisis. So it is crucially important that health professionals in that role of putting people at the center of everything we do are at the forefront of the climate negotiations and the climate conversation, ensuring that we, A, strengthen our health systems, because they're the ultimate, we call it, first line of defense against the health impacts of climate change, that we prepare our populations to cope with these increased pressures, and that the health workforce is instructed and prepared to cope with new challenges that we will be facing. But I think most importantly, the health professionals have to be very strong in terms of demanding urgent mitigation. We need to understand that without urgent mitigation and the phase down and phase out of fossil fuels, we will not reduce the pressures on our health systems. It is not possible to adapt to 2.7 degrees. We've seen so many health impacts already at 1.5 that we're not being able to adapt to. And perhaps what is most important is that from the health sector, we have an enormous role to play. Because if we were to implement and to advocate for public health interventions, including reducing air pollution, cleaning our diets, increasing physical activity, we could do much of what's necessary in terms of enabling that transition to a healthier future. So it is also on us to implement the actions and helping our patients take those low carbon, healthy transitions that are necessary to enable a net zero future.
And one of the things that you highlighted in the report is the big issue of access to clean energy, whether we're talking about energy-related emissions or the lack of access to clean household and cooking fuels. How does climate change and fossil fuel use, try saying that 10 times, disproportionately affect vulnerable populations?
Yes, Ali. So as you would have seen in some of the data that I showed you, and I only showed you a very small amount of the data that we have, climate change is disproportionately impacting on low and middle income countries. And that is both because many of the low and middle income countries are in hotter areas of the world, so they're at the forefront of climate impacts, but also because the frail health system means that they have less capacity to cope with the impact, to respond to the impact, and to recover when that impact has happened. So that leaves the countries in a much more vulnerable position afterwards that amplifies in a positive feedback loop those health inequities. So on the one hand, we have disproportionate impacts and a delay in the adoption of adaptation measures in the most vulnerable countries. And on the other hand, when we look at mitigation, low middle income countries are being left behind in that transition. And as we know, energy is essential for development, is essential for healthy lives. So we have to provide energy. We have to ensure energy access, that is the SDG 7. But in doing so, what we're doing is transitioning the high-income countries, whereas the low-middle-income countries are still dependent on energy grids, which many don't have access to, on international fossil fuel and energy markets that, as we've seen last year, are highly volatile, and the prices can fluctuate significantly. So they're bound to markets that they cannot control, and they don't have autonomy in their energy access. Whereas transitioning, particularly for low-middle-income countries, to new renewable energy solutions could mean access to energy in remote areas. The WHO has great examples of electrifying health systems and hospitals in sub-Saharan Africa, providing healthcare to people that otherwise wouldn't have had access to it. So we need to change the way that we think about climate action. It is no longer the story that low-middle-income countries should care about adaptation and high-income countries about mitigation. Doing that increases the inequities gap, increases the development gap, and we have to ensure that LMICs, low-middle-income countries, also have access to clean renewable energies and transition into a new future economy that could enable also much healthier living within their countries.
One of the biggest issues as well is transitioning to healthy, locally available and renewable sources of energy that comes at a very high cost, with people exposed to toxic air pollution, as you've talked about a little bit there. And the development gap, as you say, is amplifying as a result of that slow adoption to renewables. So to your point, and so let's put it in very blunt terms. What is the cost if we don't act now, and how bad can it get, and how quickly?
It's getting very bad and very quickly already. We've seen record temperatures being breached year after year. We now know that 1.5 could be breached within the next 5 years, if not before. So while we had done forecasts of temperature increase, scientists are being surprised about the speed in which change is happening. If we don't act now, we will not reach 1.5 degrees. And as I said, we're heading to 2.7. 1.1 is what we have now. At 1.1 degrees, we're seeing all of the impacts that I have shown you, and we're seeing the devastation that you will have seen in the news over the extreme weather events of the past years. If we don't act now, and we exceed the 1.5 threshold, small island developing states will not be viable anymore. Many of them will be under the mean level of water, and will have enormous migration from those communities. We'll have compounding impacts increasing all around the world, generating social instability, and we know just how damaging that can be. If we don't act now to provide energy in low-middle-income countries, that development gap will keep on amplifying and will generate the same structures of dependence, global north versus global south, that we have today, in which countries are unable to access their own energy and dependent on markets from the global north. So this is the moment in which we have to implement the measures to transition in a just manner. That is the key word, a just transition to a zero carbon future.
Let's open up the floor to questions for Marina. If we can bring the microphone around. If you have a question, please do put your hand up for Marina, and she will be answering those questions for you. If I can see anybody who has a question at all? No? No questions for, yes? We have one back here. It's hard to see you, Bill, back there. Professor Bill Pan, everybody.
So sorry, excuse me.
Hi, Marina, nice to see you.
I had a question. I was at the Climate Countdown meeting in Cusco in December 2019 before the pandemic hit. And at that meeting, we had all sorts of breakout sessions with communities talking about climate change and what communities can be doing. And I know the Lancet is still trying to do these kind of outreach activities, and I'm wondering what is planned. Are you going to continue running these kind of events? Because I know the communities themselves really felt connected to science when that was done. And these are, not just people in the health system, but farmers came, miners came, all sorts of different people came to these meetings in Peru, and I think they found a lot of benefit from it.
Thanks, Bill. That's a very excellent question. Thank you for pointing at that. I absolutely agree. The pandemic has done devastation for the health community and health and climate change community, because, as you say, we need everyone in the room. It's not only about health professionals, it's about health professionals and urban planners and miners and energy experts. We need everyone to come together and think about these solutions. And I do agree that the energy, and that's why I'm so sorry I'm not there with you guys, the energy of the in-person meeting and the amount of innovation that you can generate in the thought process of an in-person meeting is unrivaled, particularly when it has to do with local community engagement. What we've done over the past 3 years is expand the Lancet Countdown to have regional centers. And now we have regional centers in South America, in Asia, mainly based in China, in small island developing states, in Europe, in Australia. We're gonna open a center also for Africa. And what we're hoping is that through those regional centers, we can do a lot more local community outreach and a lot more of engaging of the local populations. But as you said, there's something to be said about what the pandemic has done to our capacity to reach out. And I would be very, very happy to have some of those events as well in London in the near future.
It is critical, as you say, Marina, for all of us to be in the room together, getting that energy going and getting those solutions to happen, because this is the kind of challenge that needs all of us to do it. Other questions in the room? Yes, over here for Marina. If you could introduce yourself, please.
Hello, Marina. I am Ramon San Pascual. I represent Healthcare Without Harm in Southeast Asia. I like what you mentioned a while ago, that this is no longer just a assignment of tasks wherein the advanced countries have to be responsible in terms of mitigating the healthcare climate impact, and that for the small countries, including those in the Southeast Asia, to focus on adaptation and resilience building. So it's not just that anymore. And you mentioned that otherwise it will just drive up inequity, even if we transition towards low-carbon healthcare. Now, we are talking about as well, therefore, in terms of the just transition, that would benefit the regular, ordinary people in terms of transitioning to low-carbon healthcare. But among countries, you mentioned about addressing inequity as we transition. I wonder if Lancet has a study on this, and because this is a difficult question to handle. As it is, the world is unjust. Now, as we address the climate crisis and the health inequity around it, we may still arrive on an unjust world still. So how does Lancet address it, and what do research says on this regard?
Yeah, thank you so much. It's great to hear that Healthcare Without Harm is also in the room. So much of the data that we have shows those inequities already. So we're seeing the inequities in the impacts, we're seeing the inequities in the transition. And what we're starting to monitor, since we've started kind of disaggregating countries by Human Development Index, is that inequities gap amplifying. You can see that particularly from the transition point of view. In terms of impacts, there's also an enormous inequity in the evidence availability. So apart from everything that I've shown you in the inequities of impacts of transition, there's also a big gap in the data infrastructure that we have in different countries and in the amount of scientific research that is being done in different parts of the world. So by and large, the vast majority of the evidence that we have come from high-income countries. If we look at the evidence of actual effective impacts on health that come from daily mortality data, from hospitalizations, from morbidity data, by and large, that data is held by high-income countries. And there's an enormous gap in low-income countries. The area that we're seeing the biggest gaps on is Africa. That is probably one of the most heavily impacted parts of the world. So what we're trying to do at the moment, and particularly with opening the center in Africa, as I said, is trying to galvanize the local research community to start looking a bit more in detail in helping us identify those impacts and those inequities that are emerging, and in providing more data infrastructure to the region so that we can expose those inequities as they happen, and importantly, do something about them to prevent them from amplifying. So there's a lot to be said about the role of this room and of this health community in terms of improving the evidence availability and the data availability for those most impacted communities.
Any more questions for Marina? I can see a hand all the way up in the back there. Last question for Dr. Romanello.
Hi, Marina. Jenny Miller with the Global Climate and Health Alliance. Nice to see you. I was wondering if you could talk a bit about what the countdown has found in terms of the degree of integration of health into levels of climate decision-making, as well as into the public discourse about climate change.
Yeah, thank you, Jenny. It's lovely to hear your voice. So we've been looking a bit about the engagement of the climate conversations with the health argument and vice versa, the extent to which different actors in society, those that can drive change, are engaging with this intersection between climate change and health. And what we're seeing is that in the engagement, particularly of policy of the decision makers, there is a lot more awareness of the intersection between climate change and health. We're seeing that in the nationally determined contributions, and that also comes from work that GCHA has done, we're seeing more and more health being mentioned within their decarbonization commitments and prioritized within them. And we're seeing that in the UN General Assembly, where countries put forward their commitments and their priorities, more and more countries are starting to mention this intersection, reaching record levels of mentions in the last year. But what we're seeing by and large is that those world leaders that are driving the commitments and the engagement in climate change and health and awareness of the health implications are those living in the most vulnerable countries, including the small island developing states, which are acutely aware of the existential threat that climate change represents to their people. But perhaps what is more telling is that although we're seeing more and more mentions of climate change and health, we're not seeing as many laws coming up, including climate change and health, and we're not seeing the level of action that we would want to be seeing from both the climate and the health sectors in different countries. So what we're doing at the moment is starting to assess different climate laws and seeing whether they include or not considerations for health, and vice versa, whether health laws include climate consideration and sustainability considerations. But there's still an enormous lag in terms of the magnitude of the impacts that we're seeing and the extent to which the health sector is being embedded in the climate conversation globally.
Thank you so much for that final question. Marina, thank you so much for joining us all the way from London this morning. We appreciate your participation in the summit so much, and we are looking forward to seeing what comes out of this coming report that is being written in the lead up to COP28. Dr. Marina Romanello, thank you so much.
Thank you, Sally, and thank you so much, everyone, for your attention and your bright questions.
Thank you. We just heard so much about the many reasons that we have to be concerned about the future of global health, but of course there is cause for hope and a healthy dose of inspiration here at the summit.